Direct anterior hip replacement, or DAHR. This video is specifically for the direct anterior total hip replacement and should not be followed if you had an anterior lateral or a posterior hip replacement. Moderate level exercises for beginning mobility and strength. These will be done less frequently throughout the day, avoiding overdoing it and aggravating the hip. You'll be performing a series of exercises that build up to a proper squat and a series of exercises that build up to a proper stair step. As you master form and perform the exercise great, your physical therapist will advance you from the first exercise in the series to the next, eventually completing all the exercises in the series to perform the fundamental movement patterns of squat and stair step. We'll begin with the squat series progression. This is a progression of exercises building to a functional squat. Seated hip hinge. Scoop forward to the front half of the chair and sit up in good posture. Keep your toes and knees even with each other, and keeping your spine straight, hinge forward at your hips to do a proper hip hinge. Shoulders should be squeezed back, stomach should be tight as you hinge at the hips. Avoid bending at the spine. This hip hinge is a necessary exercise to learn so as to be able to perform a squat or the sit to stand motion or stand to sit motion properly. You can see how it will eventually progress to a sit to stand squat, but only after you've mastered the other exercises in this series. Mini squat, or what may be considered a standing hip hinge working towards a proper squat. Performing a mini squat requires the hip hinge you've already learned. Standing with your calves touching a chair, hip hinge, and jet your hips backwards as your knees slightly come forward from the chair. Notice how the knees travel forward, but the knees will never pass the toes. The key to doing this properly is to perform the hip hinge so the hips go back, the shoulders drop down and forward a little bit, balancing with your hands on your walker or even preferably at a sink or something firm. Common errors in performing this exercise are bending at the knees too much, jetting them out in front of the toes, or arching in the back. Keeping your back straight and strong, belly button sucked in, shoulder blades squeezed back. Perform your hip hinge. Knees will slightly come forward, hips go back, shoulders drop down and forward, working towards the chair. When your form is excellent and your physical therapist graduates you, you can work deeper and deeper as you get stronger until you're able to do a full squat. A full squat combining the seated hip hinge and the mini squat. Now we're going to work on combining the seated hip hinge into a full standing squat. Keeping proper form, sit slowly back into the chair, hip hinge forward, and using your legs, stand. Avoid letting the knees jet forward or the spine rounding. Rather keep a good spine position and hinge at the hips so as to sit. Keeping the back straight, hinge forward, and stand. As long as your form is great, as you get stronger, you can go all the way down to where you barely touch the chair, but you don't actually sit. This requires much more strength in the legs and much more control. Stair-step series progression. This will be a series of exercises building up to a proper stair step. Seated long arc quad. Sitting in good form in the chair, scoot back just a little bit to lean back, keeping your spine in good posture. Keep your core tight and your shoulder blades squeezed back as you tighten up your thigh muscle and kick the leg out straight. Avoid arching forward in your spine or sagging in your core as you perform this exercise. And also avoid lifting up the entire leg off the chair, as this will aggravate your incision and may lead to some tendonitis after surgery. Keep the thigh in contact with the chair and simply straighten out the knee, squeezing the quadricep or the anterior thigh nice and strong. Weight shift leading to single leg stance exercise. Standing in good posture with your feet just slightly less than shoulder width apart, shift your weight from side to side. Make sure that you keep your core tight and your shoulder blades in proper position with this exercise, keeping your body in straight alignment from top to bottom. Make every attempt to avoid leaning as you shift your weight or allowing the hip to jet out to the side. Continue to progress with this exercise, working from one side to the other until you're able to gently pick up the opposite foot off the ground, completely supporting yourself in a 100% single leg stance. Although this is demonstrated with the walker, for safety purposes, it's best to perform this exercise in front of a sink so you can grab on if you need to check your balance. Forward stair step. Standing in front of a kitchen sink or countertop or a sturdy chair, place a phone book on the floor and placing the foot of the injured leg on the phone book, bend at the ankle and the knee, and then gently lift yourself up. Lower yourself slowly and controlled and gently tap the heel of the uninjured leg down on the ground and then lift yourself back up again. Go slow with this motion so as to feel the knee bend and then feel the knee straighten as you raise your body up. Avoid using the toes on the leg that's in back to lower yourself or raise yourself, thus using the calf on your uninjured leg, but focus your attention on the injured leg, how much the knee bends, load into it, and then lift yourself up. Also avoid keeping both legs straight and just tipping at your hip to reach the leg backwards. Keep the toes up, bend the knee, slowly lowering your body, gently touch the heel to the floor, and lift yourself back up. You'll notice if you do this exercise properly, your ankle, your knee, and your hip will be moving together as a team. Your upper body will slightly lean forward, keeping your upper body and your trailing leg in a straight line, and you'll be incorporating that ever so important hip hinge that you originally learned. Thank you for your time. We hope that these video exercises help you in achieving your goals in rehabilitation. As these are moderate intensity exercises, you won't be performing them nearly as often as you did the lower level exercises. Your therapist will guide you in how often and how many you should do. Your therapist may also have some additional exercises to help you in this progression, as this is a fairly simple progression to these fundamental movement patterns. Bottom line is, the therapist will be progressing you based on your performance, It's more important to move better than it is to move more, with an ultimate goal of being able to squat to go sit to stand and go up and down stairs with great form.